and each of group could be divided by several groups. No, zeros. They can be. Mean that inside of that tumor could be serous fluid, and that fluid describe the structure of that group of tumors. Like the result, like usually, benign borderline malignant. What do you know? Please switch off the sound. All of you need to switch off the sound. Sorry. Guys, please, I'd like you to switch off the sound. Okay. What do you know about serous tumors? Frequently bilateral, 75 of them malignant. If we see unilocular cyst, papilla less solid than borderline, if you see papillary structure inside, solid structure, hemorrhage inside, necrosis or adhesions, it means that that cyst will be with the risk of malignization. No bad prognosis for that cyst if you're talking about malignant tumor. They could be very big, until 20, 30 centimeters. Like that, like you see the pictures. Biggest type of the cyst actually inside the female organism is inside of that group, serous epithelial tumors. Most often meeting types of the tumors in the female organism. Bilateral cyst, you can see at this picture the structure after hysterectomy with adnexa. One cyst for another one, not popular structure inside can be, or risk of malignization in case if we meet papillary structure inside will be high, of course. If you see inside the tumor mucin, it's not a serous but another serological structure of the fluid, we name that structure mucinous tumor. They could be benign, borderline, malignant. Not such common like serous, rarely malignant, multilocular. Inside of that cyst could be many small cysts, rarely bilateral. They could be endometrioid. Inside of the cyst could be such structure like endometrium. That is why we name it endometrioid. Don't think that we talk about endometrioma. Endometrioma is the inclusion after endometriosis. Endometrioid tumor, primary tumor of the ovary with the like endometrium inclusion inside. Benign borderline malignant, unilateral, very high, very aggressive. Almost all are malignant endometrioids. We'll take a look at endometrioid tumor you see at this picture. Can be included inside the group of epithelial cysts else, tumor of the Brenner, mixed epithelial tumors, undifferentiated carcinoma, unclassified epithelial tumors, clear cell tumors. Well, try to imagine, guys, surface epithelial cells could be with such serious types. Ovarian stroma cells, another type of the tumor, sex cord stromal cells, gonadal stromal tumor is a group of tumors derived from the stromal component of the ovary and test, which comprises the granulosa, thecal cells, and fibrocytes. In contrast, the epithelial cells organized from the other epithelial lining throughout the gonadal wire. The germ cells tumor rise from the precursor cells of the gametes. And that is why the name of the cell germ cell. Same story. We can use only histological diagnosis. Only histological. What is inside? What is inside? Inside of the germ cells tumors, we can find granulosa stromal cell tumors, androblastomas, gene androblastomas, unclassified. Take a look. Granulosa cells tumors, the hormonally active tumor. Memorize. In the beginning, we was talking about epithelial cells. Epithelial cells tumors can't produce hormones. Granulosa cells cell tumor are like the most meeting type of the tumor from the germ cells, can produce hormones, and that's why female will get another clinical signs. The most common estrogenic ovarian neoplasm. The adult form occur mainly in postmenopausal women, associated with endometrial hyperplasia and carcinoma, like the result of hyperestrogenia. Take a look for the structure. Structure of the tumors usually solid, usually solid. Tecoma cells, they can produce estrogens too. Postmenopausal, typical story, same story, development of the reaction for high level of estrogens, endometrial hyperplasia and carcinoma. Solid tecoma cell, you can see at this picture. Very rare meeting tumor, but we need to know about. Sertoli Leydig cells tumors, we don't need to talk about it. Could be lipoid cell tumor and germ cells tumors. What kinds of stories could be if we talk about germ cells tumors? Main type of the tumor which could be meted inside of the group, dysgerminoma, chorion carcinoma, and very common type of tumor, teratoma or dermoid cyst or dermoid cyst. Germ cell. You can see the primary cell which start to produce it is a cell from the germ, and like the result, we can expect for the formation of different tissues inside of the cell, especially if you are talking about teratomas. Dysgerminoma, take a look. Can formate such type of tumor like testicular seminoma, very aggressive, malignancy very often. Take a look for the picture for the dysgerminoma, but to take a look at the dermoid cyst. What very interesting type of the cyst. Inside of the cyst, you can meet structure which can be we can describe like the structure from the skin, because one more time, germ can show proliferation of the specific cells like skin, and we can find inside of the cyst dents, hairs, bones, and so on and so forth. Fat tissue is product of the skins. What very interesting type of the cell, germ is the primary cells, and because of that story, we can formate it can formate such interesting structures. They are very big, usually unilateral, can affect any age of the female. They are very heavy. Weight of that cyst could be some kilogram, and like the result could be such serious complications of that cell of that tumor, like torsion of the tumor of the ovary. What else can be included inside of the classification about the tumors of the ovary? Gonadoblastomas, soft tissue tumors, unclassified tumors, metastatic tumors, and don't forget that we have such group like tumor-like conditions. What is it, guys? It's not a tumor. It's not a true tumor. If the condition which we can meet during our life, like for example, luteoma of the pregnancy, 50% of the pregnancy could be affected by specific corpus luteum enlargement, luteoma. That luteoma should get resorption after the finish of the pregnancy, but need we to watch for that cyst? Yes, of course, because we don't know histological structure of that cyst. Don't forget. And that's why only after finishing of the story with that cyst, we can talk about the that cyst was luteoma. Or, for example, polycystic ovarian syndrome. Is it enlargement of the ovary? Yes. Is it multiplied cysts inside? Yes. Need we to work with it? Yes, need. But can we take histological information outside? No, we don't need to operate it. We don't need to do nothing. And that's why we need to watch for them. We need to understand what is it and get serious insurance that we are talking about polycystic ovarian syndrome. That is why that condition should be included in the site of our classification. Inflammatory, the edema of the ovary, paraovarial cyst, endometriosis or endometrioma, all that cyst was included inside our histological classification. Specifically, guys, our type D, individual follicular cyst and corpus luteum cyst. When we had you acute abdominal syndrome lecture and class, we discussed that one of the reasons of the acute abdominal syndrome is the rupture of the cyst. What specifically, when we talk about it, we talk about the types of cyst. What is it? It's an abnormal, abnormal function of the ovary, and it looks like that. Growth of the follicle, the growth of the follicle should be finished by the rupture of the follicle with the formation of corpus luteum. Could be an ovulation, yes. And what should be with that follicle? Enlargement, continuous growth of that follicle. And difference between follicular cyst and just normal follicle is the size. Inclusion less than 20 millimeters had the name follicle. Inclusion more than 20 millimeters had the name follicular cyst. Same story with the corpus luteum cyst. It can get enlargement and like the result can formate inclusion more than 20 millimeters. And how me like a doctor can get that information? I can't remove all cysts in the world. I need to expect for the resorption. But anyway, I need to work with that cyst, like with the malignant cyst. I need to think, malignant cyst that inclusion or not. And that is why one day, some years ago, they formatted such classification like you see. And all tumor-like conditions was included inside of our classification. We need to understand it, what for that it was doing, but we need to work with them not like with the true cysts and true tumors. Так, okay. Summary. You see the picture. So, I didn't tell you nothing about clinical picture. Well, take a look here, guys. We can't, with help of clinical picture, tell about what types of the cysts we have. Because usually they are asymptomatic. After that, they can show lower abdominal pain because of the pressure inside the cavity of the pelvis. Could be increase of the intensity of the pain due to different reasons. And very rare, we can meet with you specific signs like hyperestrogen condition, hyperandrogen condition, only in the case when we have the production of the hormones outside from the tumor. It can be complicated, like could be rupture of the cyst, could be torsion of the cyst, but in that case we will see with you just clinic of the acute abdominal syndrome without difference what types of the cyst or tumor inside. That's why clinical picture for the ovarian tumors are same. Doesn't matter what type of histological structure we have. What to do? Now we can use physical examination, we can palpate it with help of biomanual examination, and we can formate of our diagnosis with help of specific methods of investigation. So what is the main method? Of course, is the ultrasound diagnostic. Ultrasound diagnostic. What we see in ultrasound, just I'll show you. One second, guys. Mhm. Take a look. What can we see with help of ultrasound? Huh? We can see inclusion inside the ovary, and that inclusion can be enough to tell that we have the tumor of the ovary, cystic tumor of the ovary. Could be specific types of the inclusion. Could be we can find with you papillus inside. We can find with you abnormal mass inside. We can find with you solid tumor inside. We can find with you abnormal multi-chambers. Take a look. But at that case, we can talk about necessary to do operative treatment. What papilla structure inside? Take a look. With help of ultrasound. What at that case we can talk about. Take a look for multi-chambers. Ovary. Abnormal blood supply inside the ovary. All of them, all the sides can tell that we are talking about the abnormal cyst which should be operated. That's why we need to use ultrasound for differential diagnosis. And we can find with you different signs. If we are talking about unilateral cyst, unilocular, thin-walled, without papillus, without solid areas, we can talk about possibility to watch for that cyst, but not more than 3 till 6 months. Understand why? Because it could be follicular cyst, could be corpus luteum cyst, and that cyst can get resorption. If you see bilateral cyst, multilocular, multi-chambers, thickness of the wall should be bigger, papilla presence inside, solid structure. At that case, we don't have a choice. We need to do operative treatment. Why? Because we need to improve that we talk about benign tumor. So, any moment of your life, if you have the person with the tumor of the ovary, first question you need to ask yourself, what kind of the tumor inside of that ovary? And if you have chances with help of ultrasound examination for malignant inclusion, you need to operate that person and remove that cyst, that tumor. If you don't have such chances, if you, with help of non-invasive method of diagnostic, found that we are talking about benign tumor or tumor-like condition, especially follicular corpus luteum cyst, we can watch. Our watching should be with the specific treatment, What treatment can we use, guys? Well, take a look. Just I'll show. Prevention of the complications like torsion, infection, hemorrhage, and rupture. How to do it? We need to use oral contraceptives. What for? We need to stop hormonal activity inside the female organism. And at that case, we can expect for the resorption of the cyst. We can prevent pain syndrome. That's why we need to use painkillers. And if we don't have results from our treatment after 3-6 months, we need to do surgery. Okay, guys, for today you see, I believe that it was enough for you. It was difficult, I believe, to talk about that story. Good luck. See you.